Daniel Semenza is the Director of Research at the New Jersey Gun Violence Research Center at Rutgers University. Daniel and his team at Rutgers Health recently published a study in the Journal of Urban Health looking at the long-term physical and functional challenges faced by survivors of firearm injuries. Working alongside community partners like Cure for Camden in Camden, the research highlights the ongoing medical needs and systemic barriers that survivors face long after the initial trauma. We say good morning and welcome to the show, Daniel. Thanks for your patience. We had to cut away there for a moment. We appreciate your patience.
Good morning, Ken.
Good to have you on. Let's talk about this study. It looks at what happens after somebody survives the firearm injury, because a lot of people think, oh, we patched the person up, they're out of the hospital, everything's fine. That isn't the case. So talk about the challenges long term for survivors.
Sure. So this is a very local study. Like you said, we did this in partnership with Cure for Camden. So we interviewed shooting survivors. We surveyed them to really understand what their challenges were. And what we found is that most people who are shot go on to deal with lifelong functional disability, having trouble doing chores, cognitive tasks. They often struggle with significant amounts of pain. And they often face a lot of barriers to healthcare access. They don't have a consistent doctor for primary care. They may not be properly insured. And so it becomes really difficult to maintain the long-term care that is required for such serious injuries.
Dan, is that more because of the socioeconomic situation of many victims, because shootings might be more prevalent in certain neighborhoods than others? Is that more what the impact is?
Yeah, that's a great question, and that's true. Yeah, the majority of folks who are shot and sustain injuries like this are from more disadvantaged neighborhoods where there are very high rates of poverty, residential insecurity, things like that. And so access to health insurance, consistent primary care doctors is already lower and already more of a challenge. And when a shooting occurs, that kind of compounds any existing health problems that might have existed and makes that journey much more challenging.
And it's so unfair because you have people who already are dealt in many cases a bad blow in life just by virtue of where they're located, and they have that's due to no blame of their own. And then to be the victim of a crime potentially, and then not have access to have the care that would help them through their pain and suffering later. It's just a compounded, horrible situation. And you found that a significant number of survivors have that ongoing pain and difficulty day to day. So, how does that impact their ability to work or care for themselves or even live independently as they get older?
It can make it very difficult. Being able to be independent, to work a regular kind of 40-hour job, especially if it's a more physical job, can be very, very challenging. So often what we'll find is that people who have been shot, if they were dealing with pre-existing economic issues, if they were living in poverty or having to work a relatively low-wage job, that becomes even worse after they've been shot because the medical care required often crowds out a lot of time for work, and it can make more physical jobs really taxing. And so tens of thousands of people are shot throughout the country every year. We often focus on homicides and people who are killed, but this is a much, much larger problem, even as shootings and homicides are going down throughout the country.
And you think about youth gangs. Just a thought popped into my head. When a child becomes, and I mean a child, 14, 15, they get involved in a gang. Now they become desensitized to the idea of a gun. It's like a toy. And then they shoot at each other. And a kid who might get shot at the age of 15, what kind of long-lasting psychological impact does that have on that victim? And even on the flip side, on the person who did the shooting, and how does that literally destroy the futures of both people?
Yeah, I appreciate you asking about both the person who is shooting and both the victim, because both are very much affected, especially if we're talking about children who are kind of at the early stage of development. When they're exposed to violence in whatever way that might be, especially with a gun, that can have long lasting impacts, particularly in terms of anxiety, depression, and post traumatic stress. Oftentimes, when we talk to shooting survivors, they exhibit very similar symptoms to somebody who has been through war. And so many people who are exposed to violence, especially young and on a consistent basis, are experiencing the same kind of lives that veterans have when they come home from war. And that creates really significant health challenges that can last a lifetime.
And let's talk about the program Cure for Camden and the partnership of the study with them. Talk about that program.
None of this would have happened without Cure for Camden, the research, the paper that we put out, the conversations we've been having afterward. We directly partnered with Cure for Camden. They were involved from the first day that we started asking research questions to recruiting shooting survivors, speaking with them directly, all the way through helping to write up the work and interpret the data. We work directly with multiple street outreach workers or violence intervention folks, and they were on the paper to help inform and give us kind of on the ground insight as to what was going on. Extremely valuable working with these folks, and we couldn't have done it without them.
Daniel, what's a website for more info?
Sure. So you can look up the New Jersey Gun Violence Research Center at Rutgers University. We have all the research there. You can learn about a lot of the other work that we're doing. The paper at the Journal of Urban Health is open access, meaning that everybody can get it for free. You don't have to pay. You don't have to log in or anything. So if anybody throughout New Jersey is doing this work and they want to understand some of the options for helping provide better care to shooting survivors, you can easily get that information now.
Great work, Daniel Semenza, Director of Research at the New Jersey Gun Violence Research Center at Rutgers University. Thank you for coming on, and we appreciate all that hard work you did. Thank you.
Thanks so much, Ken.